A man in Austria has been infected with Super-Gonorrhea, who is not affected by most antimicrobial drugs, new research claims. Gonorrhea that is resistant to drugs has increased for decades. Usually, this bacterial infection is treated with two antibiotics that are widely used, Azithromycin and Ceftriaxone. However, it seems that more and more bacterial strains have developed resistance to these drugs, forcing doctors to choose antibiotics that are less used. Now, reported in the journal Eurosurveillance, scientists have reported gonorrhea strains with higher level resistance to azithromycin, plus resistance to Ceftriaxone, Cefixime, CefotaXime, Ciprofloxacin, and Tetracycline. Patients, a man in his 50s, reportedly began to experience symptoms in April 2022 after having sex without a condom with female sex workers in Cambodia. The test revealed that the man was infected with a gonorrhea strain that was closely related to the strain known as HUQ. This strain has been reported several times in the UK and Australia, often reconnected to Southeast Asia. However, it seems that the strain that is resistant to these drugs has not been documented before. The patient was initially treated with Ceftriaxone and azithromycin. While this seems to clean a few symptoms, he is still tested positive for gonorrhea 2 weeks later. The doctor conducted a number of tests to see which drugs might be vulnerable to, and were finally completed in treatment involving amoxicillin clavulanic acid, which seemed to work. Unfortunately, this kind of problem has become increasingly common throughout the world. Gonorrhea, one of the most commonly transmitted infections sexually after chlamydia, can be contracted by non-protected oral and anal sex, or by sharing sex toys. About 10% of men and 50% of women remain without symptoms with infection, but many people experience unpleasant green or yellow discharge and pain when urinating. If not treated, it can cause pelvic inflammatory disease in women and infertility in both sexes. The bacteria that caused gonorrhea, Neisseria gonorrhoeae, have further developed antibiotic resistance since the 1930s, to the point where the World Health Organization now considers it as a high-priority pathogen that requires the development of new antibiotics. Without these new drugs, the gonorrhea case will soon be unovular.